So when should one be concerned about whether or not they have high blood pressure? Well, the normal range or normal blood pressure is anywhere of 120 systolic over 80 or less. So 120 over 80 or less is normal. Anything between 120 to 140 systolic over 80 to 90, those patients are what they call pre-hypertension or early hypertension. Those patients are at high risk for developing overt high blood pressure. At the point of over 140 over 90, they would be defined as having high blood pressure. So those patients that fall into that category of pre-hypertension before they become overtly high blood pressure, those patients usually don't need to get treated with medications. Those patients should probably be screened yearly during their annual physical, or if one's at a pharmacy, I always tell a patient, go in there and just get your blood pressure checked, and you could always let me know what it is if it's too high, if it's over 140 over 90. Nevertheless, those patients easily could be treated by non-medication treatment, such as weight loss, cutting down on their salt intake, not eating a lot of greasy, fatty foods, exercising daily, more than 30 minutes a day at least, either walking or running. If they smoke, stop smoking. So these are lifestyle modifications that patients would need to do if they're at high risk for developing this pre-hypertension. Now, if a patient comes in and their blood pressure is over 140 over 90, I'd like to get at least 2 or 3 readings in the clinic before I define or give them the diagnosis of hypertension. So usually those patients, I either have them get a blood pressure cuff monitor that they can purchase at the pharmacy and have them check their blood pressure either daily or twice a day for a month or so, and then bring me the readings, or they can go into a pharmacy and get their blood pressure checked, maybe once or twice a week, and then again they can bring me the readings. And if I see that they're consistently over 140 over 90, then I would feel confident enough at that point to diagnose them with hypertension or high blood pressure. Now, there's different categories of hypertension that I would just briefly mention. There's the primary one is when you're in the range of 140 to 160. Those patients tend to do well long term if they're treated appropriately. Then you have a second tier where the blood pressure gets over 180 over 200. Those patients need to be treated more aggressively, and obviously those that have blood pressures over 200 tend to be in a category of being at serious high risk for developing complications of hypertension, which I'll describe later in this video.
Medtwice.com